It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Okay, our first guest today is Dr. Don Abano, director of the Vasectomy Center. This is a topic of conversation that many couples have. And when men choose to have this procedure, it's something that, of course, is not without a lot of thought.
Yeah, exactly. Yeah. Well, last time we talked about a massage for Valentine's. What about a vasectomy for Valentine's, huh?
All right,
how's that sound?
Let's hear from Dr. Abano and Shannon O'Kelly.
Dr. Abano, welcome. How are you?
Good. Thanks for having me.
Well, thanks for joining us here on Health Talk. And we're going to talk about an interesting topic we may have talked about in the past, but it's always good to have this conversation, particularly in the new year for a lot of folks out there that may be trying to make maybe some changes or do something different with their health. But tell us about your practice. I guess that's where we want to start. Tell us about what you do.
Oh, so I run a Vasectomy Center. We are in Swedish Issaquah and in Shoreline, but basically we make it easy for men to come in who receive the safest, most comfortable vasectomy possible.
What's the name of your practice?
The Vasectomy Center, we make it pretty simple.
Yeah, make it pretty simple.
Yeah.
Let's talk about vasectomies. I mean, I know there's a lot of a lot of questions people have regarding vasectomies. They've changed a lot. They're a lot easier or safer, like you said, maybe than they were several years ago.
Yeah.
You make it really simple. You do a lot of education. I know how you are. I know the type of physician you are, and your goal is to make it easy on the whole family and everybody involved. So let's talk about that.
Yeah, so the whole procedure is about 20 minutes. Most of the guys come in. Obviously, some of them are nervous. Some of them are a little bit concerned about the pain. But after like the first 5 minutes, we're talking about football. We're talking about their families. We're talking about their kids. And next thing you know, they're done, and they're pleasantly surprised. And at the end of the procedure, some of them want to give you a hug, and it's a really good feeling, to be able to be part of this transition for them.
Right. Tell us about the procedure. I mean, I think there's a lot of questions. I've talked to a group of guys before, and in a group, and it's like, oh, you're having a vasectomy. Oh my gosh, I mean, sometimes the conversation in a group is totally different than the reality of having the procedure. Like you said, it's not that big a deal. Tell us about the procedure.
Yeah. So most of the guys would lay down. We do a no scalpel vasectomy method versus a traditional method where they use a scalpel, make an incision and everything. We use more of a pressurized device to numb up the area. So guys don't like needles. We don't use needles. Okay. We use this pressurized device, kind of like what you see in like Star Trek and
okay.
and they like that because it's more of a rubber band snap. And I always say, hey, that's the worst part. And true enough, throughout the procedure, they don't feel anything.
Mm-hmm.
So I think they really appreciate that. And it's there's blood loss is like almost nothing. And after the procedure, they just feel comfortable. In a few weeks, you can't even see the site where we did the vasectomy.
So it's you said scalpelless, so it's not really incision. It's more of a
puncture.
A puncture.
Yeah.
So you're just taking a device and going in there, and then tell us what you're doing. What the vasectomy procedure is. I mean, you're going to eliminate sperm production, basically.
Well,
maybe we should talk about that because maybe that's not the right term.
Yeah. So maybe not sperm production. What we're doing is we're basically disrupting the tubes that carry the sperm towards where when you have this like output, it doesn't include sperm in it. So we're not taking anything. We're not removing anything. This is more of just disrupting those tubes so that the sperm can't go out of
You can't. The sperm doesn't exit. But I mean, fair to say, I made the mistake there. You're still producing producing sperm.
Yeah.
You're still fertile. You're just not ejecting, or the sperm is not exiting. Right?
And then over time, it's very interesting that production actually either slows down or stops, or and so. People always ask, well, what happens to the sperm? Well, your body just recycles it. There's all this white blood cells, and they eat it, and they use it for protein, for energy. Most guys are concerned about, hey, will it affect my manhood and whatnot? So
Yeah, it doesn't affect any hormones that you're producing. Everything's the same.
does not. Yeah, it does not.
All right, more with Dr. John Abano right after this timeout on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation about vasectomies with Dr. John Abano, director at the Vasectomy Center, right here on Como.
Thank you for joining us. Thank you for coming in and talking about a subject that sometimes has a lot of myths attached to it. And I want to take these next few minutes and dispel any myths. So, you talked about you're still going to produce sperm. You're just not going to be ejecting sperm or exiting sperm. But the hormones in your body, you still have everything you had before. I mean, you're not going to lose any manhood, so to speak. The pain is sometimes people worry about. Let's talk about hormones, pain, return to work, the procedure, just kind of wrap that whole kind of scenario in one here.
Yeah, so most guys are worried about their virility and their testosterone, and I'm happy to report we are nowhere near the area that produces the testosterone. Has no effect. I mean, studies after studies have proven almost anatomically it's just not related to testosterone production. So that's not affected at all. In terms of the pain, because of this, we're not using any needles. We're not doing any scalpel. It's very minimal. You're just sore the first night, and the next day you almost feel better.
Do you have to wait, for activity? I mean, do you do these things, generally speaking, like on a Thursday or Friday, or, where guys don't want to take time off work maybe, right? What's the best time to do this? And if you do have to go to work, how long does it take you to get back to work, lifting, pushing, pulling, if you have a fairly physical job?
That's actually a good question. Our clinic is actually open Thursdays to Saturday, and we have Friday night appointments. Personally, I would do it on a Thursday and give me about 3 days of rest. But a lot of guys, they can't miss work because they're the primary breadwinner for the family, so to speak. So they go to work on Friday, and in the afternoon we do evening, kind of like afternoon, evening clinics. Or if they can't do that, they'll come in on Saturday. You need about 2 to 3 days of rest. I always emphasize that because the guys who do more, like, I feel okay, I'm going to go walk in the mall. And then that's when they end up with problems. Heavy lifting, maybe just light lifting for the first week. No intimate relations for the first week. That's very, very important, right? But other than that, if you do it really well in terms of the recovery period, if you just follow the instructions, no problems.
What about, I think one of the questions I often have heard is, are these reversible? I mean, can you reverse a vasectomy?
Technically speaking, yes. However, it's very expensive. And no guarantee. So we always consider vasectomy a permanent procedure just because of this. And insurance won't pay for it.
Will most insurances pay for the primary vasectomy?
Yes. So that much, yeah, it does.
Yeah, as we wrap up here, great information. I mean, thank you for your time. Do you want to leave any kind of message for any of those guys listening to kind of let them know how easy it is?
Yeah, so the whole point of my clinic or our clinic is just to provide a very safe, a very easy procedure. You don't need to come in for a pre-visit. We do all the counseling online. If you have questions, we can pick up the phone. Or if you want to meet, then we'll see you in clinic. We try to make sure the cost is not also prohibitive.
Good work, Dr. Abano. Thank you for your time and great information.
Thank you. Thanks for having me.
That's been Dr. John Abano, director of the Vasectomy Center. Vasectomies certainly have come a long way, and it's something that sounds like it's a lot more safe and simple than it used to be.
Well, John's fantastic. I mean, Dr. Abano, he really makes it easy for everybody, timing-wise. I mean, he does it over the weekend, and it's minimally invasive now, and it's not what it used to be, so there's really nothing to be afraid of.
Next up, Dr. Mark Wagner is going to be talking about stem cell treatment when we continue after this time out on Como.